I teach about sexual reproductive health and rights for the youth. I teach the women about their health, and also before pregnancy, how to prepare for the pregnancy, what we call preconception care. I teach them how to take care of the pregnancies, labor, how to deliver, things that affect the babies. I teach everything that you know about that can ever affect a woman, and I give them solutions. And also being aware of something helps you in case you land on it. And I also recommend them for the help that they could be needing. And it has impacted lives. It started as I'm always since the day I told people and they understood, I knew that I can teach something and someone can pick it. That is one. Two, when I bought a good smartphone, I was like, it can record. So what am I doing? I started the TikTok videos. I started sharing the same videos I record on Facebook, because not everyone uses TikTok, but most people use Facebook. So I also started a YouTube channel, but I haven't developed it. So on the TikTok channel is called Bonnie's Perspective on Health. Bonita's perspective on health, what Bonita knows. And of course, I tell them it's what I talk from my experience, from my medical knowledge that I have, how I feel about things. So every time I'm recording, I tell them, welcome to Bonnie's Perspective on Health. And we have been talking about very many topics: contraceptives, UTIs, pregnancy and delivery, breastfeeding. What haven't I talked about? Breast cancer, cervical cancer. A lot of information is out there.
Welcome back, ladies and gentlemen, for second episode with our superstar Bonietor Amanya, Mrs. Mother of Two, social media phenomenon, singer, proud daughter, person from Kanungu, making waves on Facebook and on TikTok and now on YouTube. When we completed last week, we talked about her clip, which we are going to play for you, from 2015 when she was on Cornerstone, the documentary about Nyaka.
My father died because of stigma. The day I wasn't home, I had gone to school, he hanged himself to death because of stigma. The community thought I was HIV positive. So whenever I would pass, I would be like, that girl is with Slim. Each and every disease that comes is defeated by the white blood cells. Because I was involved in the programs and had much knowledge about HIV/AIDS, I knew how to handle that stigma. And I came to a point of accepting it. I would tell them, I'm HIV positive, but I don't want to give it to others, so do like that. Yeah.
But you're not HIV positive.
I'm not, but I had to accept it in order to sensitize others about HIV. So we begin the skit. I load the skit in order to help the people know the difference between HIV and AIDS, because they use it to say maybe HIV is AIDS. So the skit was purposely to show how HIV comes into the body and what it does, then how AIDS comes in after HIV has lowered the immunity of the body and very many diseases come and attack the body. That's what we call AIDS. Just because it lives and feeds only on the white blood cells. And I think they now understand, and actually the community also understands the difference between HIV and AIDS.
We are so proud of you, Bonietor. The message we pass to everybody who passes through Nyaka is give back. Beautiful World Canada, same mission. Ladies and gentlemen, Beautiful World Canada was started by Sarah. My friend Sarah, when she opened it up, she said to me, I want to reach 1 million girls around the world. I should ask Sarah how many we have reached so far, but I know every year Nyaka brings in 100 scholarships for girls. So thank you, beautiful world Canada. Bonita, once again, shout out to your pioneer class. Victory for My Village is a book where you'll find Bonita's picture, find Bonita's little write-up when she was at university, but now she's working. So let's talk about the work now. You came up with an idea to bring hot cloth to reduce tearing in women.
Yes.
How did you figure that out? And how has that worked out? And why did you start these Facebook messages and what do they call them? Short videos and TikTok. Why did you start doing that for the whole public? I think people need to be paying you for that information. Why are you giving that information for free?
I think I'm working on something that I will be charging, but there will also be the free part of it. Now, the very first video I recorded, I told people that I have too much information about maternal and child health that someone needs. Because, Papa, people always contact me. Hello, Bonita, Musawo, I have this and this problem. I have this and this challenge. How can I be helped? And I always help them. But remember, knowledge is power. So
Amen.
I decided to do this to educate the public about maternal health related issues. Why I focused on that is because I have a passion for helping mothers and the newborn. Not just that I've left the men out, they can also benefit because you have a sister, you have a wife, you have, I don't want to leave the men out.
Yes.
But most of my information is focused in that way. I teach about sexual reproductive health and rights for the youth. I teach the women about their health, and also before pregnancy, how to prepare for the pregnancy, what we call preconception care. I teach them how to take care of the pregnancies, labor, how to deliver, things that affect the babies. I teach everything that you know about that can ever affect a woman, and I give them solutions. And also being aware of something helps you in case you land on it. And I also recommend them for the help that they could be needing. And it has impacted lives. It started as I'm always, since the day I told people and they understood, I knew that I can teach something and someone can pick it. That is one. Two, when I bought a good smartphone, I was like, it can record. So what am I doing? I started the TikTok videos. I started sharing the same videos I record on Facebook because not everyone uses TikTok, but most people use Facebook. So I also started a YouTube channel, but I haven't developed it. So on the TikTok channel is called Bonnie's Perspective on Health. Bonita's perspective on health, what Bonita knows. And of course, I tell them it's what I talk from my experience, from my medical knowledge that I have, how I feel about things. So every time I'm recording, I tell them, welcome to Bonnie's Perspective on Health. And we have been talking about very many topics: contraceptives, UTIs, pregnancy and delivery, breastfeeding. What haven't I talked about? Breast cancer, cervical cancer. A lot of information is out there. And, Papa, I realized that not only English, people who speak English are following me, but also other languages. So I record videos in Uganda because I stay in the central part of Uganda, and that's the dominant language, but I also record videos in Runyankole Luchiga and post those for my people at home to benefit. And I tell you what, people have benefited. They come to my inbox, they appreciate, they seek further advice. And recently, I also have people from watching my videos who tell me, help me, accompany me to labor in the hospital. And I have been there. I have gone with them to the hospitals as they labor. I have seen some things that were not comfortable for these mothers in those hospitals, and I've not kept quiet about them. I've also spoken and called out a few things on my channels. And some people, it doesn't rub them well, but others see it and improve. And I thank God because a woman, a mother, is benefiting.
Yes.
All right? So I was inspired by your message to give back to the society. Bonita cannot touch everyone, but my voice and my video can reach afar. You understand? That is why I started recording the TikTok and the videos I post on Facebook. But I have a very big vision. I don't know whether to share, but I have a very big vision because in the future, I want to impact very many different people,
Yes.
starting from young girls, especially with the topic of menstrual hygiene.
Yes.
I want to impact the women, but it is work in progress. And I know since I've stated my visions to God, there will be a way. Because I feel uncomfortable when I enter into the hospital as I'm accompanying this mother that phoned me from my Facebook to give birth, and there are things that are being done in that very hospital that are not right for the mother and the situation she is in at that very moment. And then I keep saying, when God will I have my own enough money to build my own facility where I have control on what is going to be done on this woman. But that is not enough. I need to speak to as many girls as possible on how to take charge of their lives. Because the world is a cruel place, Papa, to say. Sorry to say. But
Oh
it's a
no,
cruel place.
it is the what you are doing is service to humanity, is ministry. That vision you have, write it down, make sure you follow through. And you said something earlier when you prayed to God and your favorite song being Make a Way. You know that song is there. The song
Yeah.
Make a Way. You are a singer. If you have, maybe before we close, we will ask you to sing. I've asked a few people here to sing a song. Bonita, the world is cruel, but the world has people God has chosen you.
Yes.
And not everybody is set to lead. Those of who decide they want to lead, the tools to help you lead are there. Do it. You remember when Jenna Simon, the former chair of the board, started a program with Vital Health Africa to save babies. You know, since you deliver babies, in the first second the baby is born, many people in Africa, in rural areas of the world, when that baby is not breathing, they throw that baby in the trash, they are dead.
Yes.
All it takes, and I'm not a doctor, I've never been a healthcare worker, but through Genesis, I got to know that some few presses on the chest of that baby, you can get that baby to breathe within few seconds. But nurses are impatient, doctors don't have time. A baby is thrown away and they end up dying when they were not supposed to die. Maternal health and child death, early death of children is
And
huge
then you need to death.
service that you can do. And also, I know you are accompanying these women yourself. There is a way now you can train non-healthy workers, community health workers. There's a whole organization I work closely with called Last Mile Health, started by a good friend of mine, out of Liberia. Now it is all over the world. People like my mother and your mother delivered babies. And those
Yes.
babies had more survival rates than the babies born in hospitals. The patience, the care, the caring you are talking about, those women, Mrs. Biabrachiria, who was a teacher at Nyaka Primary School, most of her babies were delivered by my mom. I never went in that room. The husband will come running, Mzee Biabrachiria, oh, Janet, she's in Lebanon. Mama will come and with her razor blade and whatever she grabbed, with soup, hot water, whatever she did. But there was no tearing, there was no sickness. The
Thank
babies
you.
are all healthy. The Florences of Biabrachiria were bathed by my mother. So you have the knowledge, you have the language. Thank you for using it. And some other Nyaka graduates, Brea, out of Mbalala, is doing home care visits. This is a young man who graduated 2 years ago from Bwindi nursing school, already self-employed, takes a boda, comes to your home, takes your blood pressure, makes sure your feet are swollen while drink more water. Here's the medicine to take for tonight, checks on you tomorrow, and it is a service that is needed, which you can get health care workers to work with you, train basics, and send them out. Yeah. So you started a YouTube channel because of these women. You do it in Ruchiga, in Uganda, and what the results have been enormous. What's your vision? You don't have to say it today. You can send me
My
your
vision,
You don't
like
want
I said,
No.
number one is to reach to as many women as possible, as many girls as possible. They're like in 4 parts. One is for the young girls back in the villages, not even in Kanungu, also in all over the country, even in other countries. There are other girls who are going through this system that is somehow very much unjust to them. Girls are getting, just like my mother fell a victim of, getting pregnant at that young age. Speaking to these girls with a message that they can come through and succeed, go to school, and then they can deliver later. To delay to get pregnant, I have that package that I give to that group of girls. And then also another group of young adults, when they are making decisions in their life, what their health means. Because of recent, I was speaking to the young adults, the ages of 19, 20, 25. That age bracket is very sensitive. I told them it is okay to be on contraceptives to avoid getting pregnant. It is perfectly okay. But remember, there are sexually transmitted infections like HIV/AIDS.
Yes.
Of which you could, I will sleep with people after I've tested for HIV. If it is negative and I'm negative, then it's okay. But there is HPV, human papilloma virus, that leads to cervical cancer. How are you preventing that? I told them there is hepatitis B. You have to take charge of your life. Thank you so much. Remember, those other diseases, you could prevent pregnancy, but then you could be cut short because of the HPV, because of hepatitis that you have just acquired. So I wish that message can reach as many as possible. Then, of course, I have a vision of having a very big birthing home, maternity home that will support the mothers throughout all the stages of labor. And by the way, Papa, we always want to stop on after giving birth. Congratulations, it is done. But there is postpartum period that is hard. And these mothers need to be supported throughout that period. I know the government has put up facilities, but it stops on labor. It stops right there. After giving birth, you're gone. They say bye. And these mothers need extra support. And by the way, some other thing I hadn't told you about, Papa, I also teach health workers. And I've facilitated, I think I've done so far 2 sessions of teaching health workers on what we call respectful maternity care.
Mm.
And I think in May, I facilitated a workshop for 5 days in Busoga region. It's a very big region. And I was teaching these health workers on how to help this mother respectfully with their newborns. And it is a lacking component in the health system. And there is this special group of the mothers that have unfortunately miscarried or lost their babies, stillborn or even neonatal deaths. That group, because of the culture and the sensitivity of the matter, they are always they're not talked about. It's like you've not given birth, but yet you've given birth, you have all the fluctuating hormones, you do not have the baby, and you are seen as a curse, like something that has happened to you.
Cool.
Even the health workers at the hospital, do you know where they put those small babies? In a box, the box of the medicine, like, no, but this is a child, this is your child.
Yes.
And that element is bereavement care is much more ignored in our health system.
I'm going to make a connection for you, Bonita. I spoke to a woman who is a good friend of mine in Uganda called Kechmuri. Kecho has an organization called Vessel in Me.
Is me.
Yes, you know the organization. You've heard about it.
I've heard about it.
Ladies and gentlemen, this is what Bonita is talking about: bereavement after miscarriage, or an abortion, or abortion got long. You know that in your class of pioneers, we had a girl who had an abortion and it went really wrong. She nearly died. But because of Nyaka's encouragement and love, we got her to come back to school, and now she's a successful professional. I don't have her permission to share her name here, but you know who I'm talking about. When you lose a child, you are absolutely right, and our system and culture does not want to address this.
Talk about it. It
Partly,
doesn't.
men don't want the man who's either husband or a boyfriend is like, come on, baby, we need to have another child. The care of what happened, the grieving of that child. Even now, you start learning, oh, by the way, Jackson, before you were born, your mother had a miscarriage. It is a by the way. It's not something they even count. Those babies are not even given a proper funeral. So that you have so much to do. You have girls as they are growing up. You have young mothers like your mom went. You have mothers who are delivering and nobody even is giving them the care. You have postmortem. In New Zealand, I spoke at a conference in New Zealand. New Zealand government has a program called Praton. The child, when you get 6 months, the government of New Zealand enrolls you in a program to care and check on you, whether you are a woman on the street or the president's wife, the prime minister's wife. They don't have a president. And they will care Pranket. It is called Pranket. Pranket.com. We will put the link in this. Pranket.com. Every child in New Zealand is a Pranket baby. 6 months to 5 years.
Wow.
They will take care of you. I spoke at that conference in 2011. I was so proud to see that the government doesn't have to do it in Uganda, but you are doing it. From 6 months to 5 years, they give you even the bear, the diapers, the milk. If you can't produce milk, there is an organization recently that won an award in Uganda that collects breast milk.
Yes.
Who are not able. I saw your episode on breast milk and its potential. People admire us, how strong we are, how immune we are. I've never had malaria in my life. I didn't have COVID. I've never had Ebola. Mom's breast immunity still stands in this man today. Then you see the children who are breastfed for 1 day or even not. We have
Not
women
all.
in this country, and now it is coming to Uganda, because they have smaller breasts. they go and have a boob job at the plastic breasts at 15, 16, 17, 20. Once your breast is tampered with and you have breast implants, ladies, I know many of you are watching and you have them. I'm not judging you, I'm saying the fact. And you have a baby, that baby is not going to breastfeed. They are denied the milk, that episode you did on breastfeeding. We can link it in here. They are denied the immunity. They are denied the bonding. They are denied the heat that they get from their mother breast. For me, I breastfed until I was 5 years old. I went to school, P1 Zoro, my primary school. Come back home, mommy, and I would go breastfeed.
No wonder your mother was a birth attendant. This wisdom.
She breastfed me. My dad said he can't when we still hide in a latrine and breastfeed. Me, 5 years old.
Very good.
And I climbed Mount Kilimanjaro the other day and people said, how can you do that? Immunity from my mother, Janet Kaguri. Speak and preach, please. We have 2 more questions. Please go ahead and finish the postmortem.
It's postpartum, Papa.
Postpartum, you see? That's why
Yes.
I educated you so you can teach me these words. Postpartum. Postmortem is something after somebody has.
Yes.
Please talk about miscarriages and some of those causes. So people who are, and then we will get you with Ketchumli one of these days on another episode to talk more. Okay, so your audiences are all over the place. You are doing workshops through your work. Have you started targeting churches? Ladies and gentlemen, our faith communities, Uganda is a Christian country. Our first lady, who I met recently, and we spoke a lot about things we are doing in the country, is a believer. And she's a woman who is advocating for women and children and girls. She would love this, or make sure she watches pieces of this. Because we have churches in every part of the country, Nyaka wants to work with churches, faith community, to turn around these customs that are holding us back.
Yes.
How is raped in a church? Please don't talk about it because it's going to shame us. A pastor's wife, is being abused and beaten all night, and the husband comes and preaches the best message, and people don't want to talk about it. Children are dying, and nobody is giving them the right funeral, but they want to give the minister's child the funeral. A miscarriage is not mentioned as a death. These churches can be advocates.
Yes.
So while you are reaching out to government centers, find a way also to use the scripture to reach believers. They already congregated, they're already in one place. That's how Grandmother's program has grown. And teach people in churches to do these things. They can become bathing places. On Wednesday until Thursday, why can't women deliver there with health workers? If it is complicated, then they go to the hospital.
So what you talk about is important because in Uganda, the church leaders, the religious leaders are listened to more than actually any other people because they expect them to be having a message from God. They are highly respected. And when we take this message through them, many people will get it and it will be helpful. So yes, I've had a few opportunities to speak to church congregations, and I always package my message craftily to tackle these sensitive issues, not to annoy them, but to package them well. But it has not been as wide as possible. But I know one day, I will reach there. The best is yet to come.
That's right.
Yes.
Now, go ahead, finish your thought first.
I was talking about the local council, communities. If the message can go through them, it can reach many as well. So there are very many areas to target. I am not yet there yet, but I am on it.
You are on it. So you've talked about the success stories, mostly during COVID, what you've done using Facebook platform and what you've done using TikTok, and now also looking forward to opening a YouTube channel. By the way, when you think of Zituni Church, healthcare is the reason that church is there. My grandmother, Marisa Rukwira, was taken to Ishaka missionary spot for Seventh-day Adventist when she had hemorrhage, and when Grandpa Rukwira took grandmother and they prayed before they administered medicine, so when he came back converted as Seventh-day Adventist and built the first church in the region of Kigezi,
Wow.
Dear Church. You didn't know that?
I did not.
The result of that, now we have that beautiful church. I built a bigger one, but grandfather started it. So health care, two things that bring many people to the Adventist church: health care, education, and singing. Singing being number one, by the way. It's an opening for people to come. But when they get in and see our health message and health care and education, those are our amazing gift to the world. No matter what belief system people are, they will tell you, Adventists will sing.
Mm-hmm.
They live longer because mostly
Yes.
and health care, and they provide amazing education to the world. And you've done that. So you shared success. What challenges are you facing? And after that, I'll ask one more question and I'll let you go to bed because it is late in Uganda.
Okay.
Challenges. What challenges?
There is one success I hadn't shared, and that is the mentorship I do for some of the Nyaka students and other students, because I have a very big successful story I always want to share. Because I met this girl who was 16 years old and she was pregnant. She was in senior 6. She was pregnant and she had no hopes because at home it was a taboo. They were chasing her away, even the mother of that girl. Even when I had told her, come stay with me in my single room, that I had my husband, my child, and that girl, the mother came to visit, but during that visit told me, let me go to buy some clothes for her. She took the girl to some abortionist. The girl called me in the toilet and told me, by the way, what they are discussing is to abort my child. Immediately, I called the mother. I told the mother, that child is my responsibility. Do not do that. She apologized, brought the girl back. That girl delivered. I delivered that girl. I was in my internship before I even started working.
Yeah.
Yes. That girl, after 3 weeks after giving birth, she did her exams. She passed well, and Nyaka sponsored her. Praise Jesus. Nyaka! Coincidentally, Nyaka sponsored her for university to MUBS.
But
You know the girl, I will not mention the name. To MUBS, and she's doing wonders. The baby has grown. The girl has. I mentored that girl. I prayed for that girl. The baby was born. The girl's life continued. What kind of success do I want apart from?
wow, look what God. We need to start having Nyaka babies. First name Nyaka, last name Nyaka Nyaka.
I couldn't leave that success story.
Wow, that's really, really beautiful.
Yes.
Thank you for sharing that. Oh my God. Really?
Yes.
There are so many girls on Nyaka scholarship now. I used to know people, everybody. We encourage you, alumni of Nyaka, to go in our WhatsApp alumni group and get the Facebook group also going so we can all stay together. These are the type of things you need to know and stay encouraged. At the time when you think everything is gone, you are in the toilet, they are going to abort your child, there comes a savior called Bonietor.
Yes.
Through God's miracles, you end up on the same scholarship within Inyaka that she also went on. What else? Legacy for my village. The book
I'm telling
coming up.
you. Is that an upcoming book?
Yes. Coming soon. All right. What about the challenges?
The challenges. Challenge number one is the beliefs that people have. They are topics that are a bit sensitive. Now, contraception is one big controversial topic, especially in my church community. The Seventh-day Adventist Church, contraception in some countries is a bit still controversial. So I get
Catholic Church is number one that does not like contraceptives.
Yes, so I get some opposition. And those the other things like talking about the miscarriages, the death of the young babies. I always get opposition from different communities. HIV is still a topic that people do not want to discuss. Yep. HIV related stigma is still there. But I'm trying. I'm sharing messages here and there. I get some opposition. It's a bit of a challenge, but we are overcoming it slowly by slowly.
I will tell you something to encourage you. When I started Nyaka organization 24 years ago, my sisters, Faida and Christine, my brother and sister were already passed away, Frank and Babazi. My two sisters said to me, Jackson, you were raised Seventh-day Adventist. Why is Nyaka not a Nyaka Seventh-day Adventist organization? What you just said is the reason why. The conservatism and dogmatic belief and bureaucracy within the church system. I say it loud. Bishop Kakuru knows it. I told him about it before. The church here I go to knows it. I started in Nyaka to reach every person regardless of their religious belief, regardless of their background. Just because there is God, there is a need, we meet the need. Love and care are my number one concerns. Not where you go to worship, not the abortion you had, not the contraceptives you take, not the choices you make. Love. God is love, the God I serve. The Muhammad and Buddha and whatever somebody worships, when they start their own, they will do it the way they want. Love, number one. So don't be discouraged by what your church pastor tells you, by what belief system the elders are saying or deaconesses. Do the right thing, show God's love without any discrimination against it.
Yes.
Made by Jackson, 24 years later, Nyaka is still successful. I am still Seventh-day Adventist. We're still preaching and we've baptized way more people into the church, more than the churches themselves. And we still preach the message through Nyaka. You don't have to be labeled that you can't.
Yes.
Done on record, everyone can hear it. Last question for you.
Then the second challenge is the knowledge gap. There is a very big knowledge gap in our health system, even in the mothers and our society. There is a very big knowledge gap that when you take this woman to a hospital, they are not given the care you expect, and you face some kind of opposition, yet you know this is the right thing that should be done. And unfortunately, the nurse or the midwife or the doctor, the specialist you are meeting does not know this. And the biggest thing that disturbs me is disrespect for this woman that is in labor. I mean, you have to know things about your health. You have to know your progress. You have to ask questions. It's not a thing of telling you, take off your knickers and get on your bed, because women have traumas. Some people have been sexually assaulted. You cannot just tell them, lie on the bed, take off. That small part of even explaining to them, Papa, it is still lacking. I am telling you the truth. And it's a challenge, because when you want to, in the very humblest way possible, to tell this health worker that, by the way, it is important to explain to this woman so that she understands what you're about to do, so that you do not scare them. You are seen as, who are you? Who are you? What are you even doing?
Yes.
It's a very, I just labeled it knowledge gap, but I think it has a bigger name. It's a very big challenge that I am facing. The third one is, yes, women have been empowered, but we still need to empower women as much as we can so that they are able to stand up for themselves, even to overcome the GBVs you hear about. It is still a big challenge in our society. Because you, as a woman, you have the right to ask these questions. You have the right to refuse some things that you're not comfortable with. But they go, things are done to them that are not comfortable with them. And then during the postpartum period, they come to me with a heavy burden because something that they did not want to happen actually was done to them. I wish many can be empowered to stand up for themselves. And even some of them are educated. So there is the difference between educating this woman and empowering them to stand up for themselves. That's another challenge. Another challenge, the fourth one is funding. I want to do these things, but they need some funds. They need funds. At even recording the videos, you need internet. You
That's
need
right.
funding all through. I use my savings to reach out to a few, but I need more.
So
And I know God will make a way.
when you do a video, and this is a fundraising, it's a fundraising tip. The messages you are passing on are life-changing. Whenever you do a video, leave there your number or Momo, create a Momo, and say these things cost money, people. And if you are touched, leave something to touch another person. If somebody gives something to you, make sure you let them know what they left, what they did. Somebody, that girl who made that phone call in the toilet, there are millions of them who want to make that phone call today but have no one to call. But you can't do it alone. You need a team. You need to train somebody who answers the call, who sends some trained person you do. So expand it. Get it done, collaborate, form partnerships, and the best will come. I have one last question for you. Everyone who's ever been here is asked this question. When you look back to when you were 18 years old, that was what, 3 years after your dad passed away. Knowing what you know now, what advice would you give yourself at 18 years of age?
First of all, I would give that girl a very big hug. The 18 years old Bonita.
Yes.
I would give her a very big hug and tell them that you can make it. At that time, I had fear. I was not so much exposed. I had fear of the unknown, too much fear. I would advise that girl that God has already created a path for you. You just have to be focused and you will make it through. No matter what you face, no matter what the obstacles, joy comes in the morning.
Right. Amen. Amen. With that, ladies and gentlemen, we'll let Mrs. Mother, healthcare worker, Nyaka product, Seventh-day Adventist girl from Kanungu, turn to be this professional to go get some rest. Thank you so much for making time. For all our listeners, thank you for making time to listen to 2 episodes we've recorded here with Bonietor Amanya. You will find more information down in the comments. Share, ask, make it go all over the world, because the issues we have discussed today are all over the world within poor communities. Even here in the United States, Bonita, women are going to the hospital and they are delivering in the worst circumstances. Women are raped and get miscarriages in this country. Health care is a big issue. You read about it. But it is worse in Chinaba, in Karamoja, in Moroto, in Soloti, all over the world. So join us as we continue to make a difference in our communities, to our church communities all over the country and all over the world. You are the ambassadors of Christ. So save the lives you preach to every Sunday. Open up the doors of your worship places so they can be community centers that can serve people throughout the week rather than one day a week. We love you all. God bless you. And continue to subscribe, to share, and to learn with us. Thank you for watching. God bless you. You want
God
to
bless
sing?
you too,
You
from
want to sing close us up? Or
should I? Okay, let me sing something.
this? That will be the end. Thank you.
Okay. I asked my mother, what will I be? Will I be pretty? Will I be rich? This what she said to me. Que sera, sera. Whatever will be, will be. The future is not for us to see. Que sera, sera. What will be?